is so great to be here with all of you who are fighting in the trenches, fighting the good fight to protect liberty and freedom. You are the heroes, and you are the ones that are doing it every single day. You're the defenders of everyday citizens who are trying to make a better life for themselves and for their families. So thank you for all that you do. And I want to thank Pharma for sponsoring this luncheon. I want to thank Alec for giving me an opportunity to talk about this thing called 340B. Okay, so Lisa mentioned it. She brought it up. A lot of people are scratching their head. If you don't know what this is, it's probably because you haven't had to. It's a federal program. But now, I'm imploring you to know more about it. And here's why. It is an opportunity to give you a chance to fulfill the ALEC principles that every single one of us who has come to this conference on a regular basis understands, and to embrace as part of your work as lawmakers. So what I want to do is share with you a little bit about what Lisa started talking about, this 340B program, but I want to give you a unique perspective, because I have a unique perspective, because I look at this issue through three different lenses. The first is a former pediatric nurse practitioner who worked with the very patients for whom this program was designed. In my case, the needy and underserved in the inner city of Milwaukee, Wisconsin. And thank you all for coming to my state, those of you that you did last week. So I have firsthand experience seeing the value of this program and what it has provided for families in its original intent and design. Key words, original intent and design. Now we all know government creates all kinds of programs, and somewhere along the line, things change. So my second lens that I look at the 340B program, and I'm going to keep saying 340B because I want you to remember this, is as a former state senator who served on the very powerful Finance and Budget Writing Committee, where decisions on how to allocate precious taxpayer dollars can be quite contentious, as many of you who serve on those committees know. I'm very aware of the pressure that you are under when discussions are made about how taxpayer dollars are spent, to make sure that they are spent wisely and efficiently for those who most need government assistance, and to make sure they're prioritized. The final lens that I look at this topic through is my current role as Senior Vice President of State Affairs for National Taxpayers Union, the oldest taxpayer advocacy organization in the country. I'm now in a position to advocate on behalf of taxpayers across the entire country, in all of your states, not just my home state of Wisconsin. So with that as a backdrop, I implore you to take time to fully understand this issue before being swept into sponsoring legislation that will harm those who desperately rely on the helping hand of government, and to prevent unintended consequences that this 340B program, or reforms to 340B, may wreak on the health of our pharmaceutical industry and its promise to provide all of us with life-saving medications at affordable prices. So, the 340 program was originally conceived as a targeted method of providing affordable medications to needy patients, not as a gateway to systemic price controls. And we all know we don't like price controls as free market lawmakers. Taxpayers, including your supporters, have a major stake in preventing even more burdensome government mandates and manipulation into the healthcare market. And that's exactly what the vast majority of bills that have been starting to crop up across the country in state houses have been doing. They create regulations and they manipulate an already artificial healthcare market. So you as lawmakers are truly in a position to push back, but you have to do it from a position of understanding. And that is understanding the current federal and state implications of this policy. As currently, this 340B program is under extreme scrutiny from the United States Congress. It was created in 1992 as a well-intentioned program, as a public-private partnership to deliver prescription drugs to moderate-income families and patients. 340B has increasingly become controversial amid allegations that providers are gaming its structure to earn revenues and distribute medications well outside the communities it was intended to support. Last year, my organization, National Taxpayers Union, actually commented on legislation before a subcommittee of the United States House Energy and Commerce Committee that would step in and place, the legislation would step in and place guardrails on the 340B program and its growth. Among the changes that were contemplated then were that Congress would codify the definition of any 340B beneficiary. It would ensure that facilities that utilize the 340B savings are audited for compliance, and that revisiting automatic eligibility of disproportionate share hospitals who receive these benefits. So given the potential for Congress who is currently considering these and other structural reforms, advancing state legislation at this time could be establishing a regulatory foundation built on a house of cards. So I urge you to be cautious. Let me give you some quick facts. The program of today is not directly benefiting the patients it was supposed to. Biopharmaceutical companies provide tens of billions of dollars in 340B discounts every year, and the intended purpose, as I have said, is for these hospitals and clinics to use the money they save to improve patient access to affordable medicines, and this just simply isn't occurring. Nearly 60% of the hospitals in the United States currently participate in this program, a program that I said was intended to serve the needy. There is no evidence that expansion of the program has translated into access to medication for more patients. 2/3 of the 340B disproportionate share hospitals, you all know the name, DSH hospitals, aren't even located in medically underserved areas, meaning they're not in the communities that most need the safety net. And 65 of those disproportionate share hospitals have charity care rates that are below the national average, spending less than 2.9% of their operating expenses on discounted care for vulnerable patients. There's very little accountability in this program, and has now become a profit engine for big chain pharmacies and pharmacy benefit managers. Pharmacy benefit managers and others are using medicines as a profit center, taking over a half of every dollar spent on medications. And lastly, hospitals are buying up independent physician practices and turning them into 340B entities. This trend is driving up the cost of health care. We all know it, and here is one of the reasons why. It should be a great concern to all of you who oversee government health care programs subsidized by the hardworking taxpayers in your state. Many patients are paying more than they should at the pharmacy, and hospitals are marking up the costs of medications, which drive up the costs of insurance, including for employers, employees, and taxpayers. Something must be done. Sadly, as someone who fully embraces the principle of federalism, as all of you do in this room, fixing the 340B program requires a federal solution. Advancing state legislation right now could put your state in a very precarious legal position. Currently, legislation in Maryland, Mississippi, Louisiana, West Virginia, they're facing rigorous legal challenges. And that is not the direction you want to be taking your state in. And these cases aren't turning on minor technicalities. They involve the most fundamental questions of how states may conduct approaches to what qualifies as a 340B entity, and whether manufacturers or pharmaceutical manufacturers can be forced to recognize these approaches. These legal controversies could very well indeed be headed to the United States Supreme Court docket in later this year or next year. So knowing all of this, you, as very conscientious lawmakers, and I know you are, I've attended many of these meetings through the years. I have so many friends in this audience that I've known when I was on the other side as a lawmaker. You should avoid putting your taxpayers in your state, your constituents, on the hook for defending legislation whose legal and constitutional pedigree is currently in a major flux. So, with all of this in mind, I urge you very strongly to caution against premature consideration of any legislation which would ban prescription drug manufacturers from imposing reasonable limits on contract pharmacies and PBMs for procuring heavily discounted drugs through the program. I know that was a lot to cover in a few minutes. It's a complex topic. I hope that I at least have sparked your interest, and I want you to know that you can reach me at any time. I'll be here today, I'll be here tomorrow. You can find me at ntu.org. We at NTU are more than happy to help you develop real free market healthcare reforms that will help the good people of your state. So thank you so much. God bless, and keep the faith.